Patient-centered healthcare, thanks to digital solutions. The future, according to Sensire. We decide where we live, when we go on holiday, and who we spend our time with. But when it comes to our health, it's doctors, therapists, and healthcare workers, each with their own area of expertise and agenda, who decide what happens. There's little collaboration. Many people feel this makes healthcare inefficient, fragmented, and expensive. What if people could take control of their own healthcare? Meet Ella. She's 74 years old and lives in Varsseveld, a small town in the east of the Netherlands. Due to diabetes, mild heart failure, and weight issues, a lot of Ella's time is occupied with healthcare. It doesn't leave her much free time, and she doesn't get about much. Her son Paul, who lives in Amsterdam, tries to visit regularly, but he doesn't always have the time. Ella feels lonely. Because Ella takes a lot of medicine, her blood sugar levels need to be closely monitored. A nurse visits her 4 times a day to do this. Ella's GP, Magda, arranges for her appointments with a diabetes nurse, heart failure nurse, cardiologist, physiotherapist, and dietitian. Ella has to tell her story again and again, and everybody offers her different advice. Sensire believes this can and must be done better. The modern digital world can play a big part in this. After consulting Magda, community nurse Jeroen is now Ella's first point of contact. He arranges an iPad for her, with which she can make video calls with anyone she needs. Ella discusses her situation with Jeroen and Magda. Together, they identify what's important for Ella and who, amongst her family and friends, can help her. She makes it clear that she wants to spend less time in healthcare and more time pursuing her interests. The 3 of them make a support plan for her. Health always in focus. Ella now monitors her health herself. She learns how to measure her blood sugar levels and inject herself with insulin. A nurse at Sensire's medical service center supervises her doing this 4 times a week via the iPad. The other 3 days, her son Paul watches from his home in Amsterdam. Community nurse Jeroen has given him clear instructions on how to do this. Paul is happy that he can be involved in caring for Ella from a distance. Ella also receives a special health patch that, amongst other things, can measure her heartbeat. This is picked up by her iPad, and if it fluctuates too much, a nurse contacts her immediately. Ella can also video call with the medical service center if she has any questions, so she doesn't have to go to the cardiologist as often. Ella's medicine comes from a Medido that gives her a signal telling when it's time to take it. Every now and then, Ella and her son Paul discuss her health with community nurse Jeroen via the iPad. They exchange practical data via a special healthcare app. For instance, in this way, Paul can let Jeroen know if he can't supervise his mother on a certain day. Socially and physically active. Ella meets Robert via an online community. Robert lives nearby. He's retired and looking for volunteer work. Ella likes cycling, but she's nervous about beginning again since she hasn't exercised in years. Now, Robert and Ella go for a ride together every week. Thanks to her new game console, Ella can do the exercises she receives from her physiotherapist at home, together with her granddaughter. In the evening, Ella uses the iPad to play Word Feud with Paul. Coordinated healthcare. All Ella's medical records are stored in her online care plan. Ella decides who can download her files to their dossier. In this way, everyone who supports Ella is connected with each other. They can easily contact each other and always have the same goal. Everyone is informed of everything that happens, so nobody covers the same ground. For example, GP Magda can directly see how Ella is doing and is contacted immediately if her blood sugar level or heartbeat changes too often. So what exactly has changed? Ella can take better care of herself and receives immediate support if she needs it. She feels more secure and confident. She doesn't need to see Magda or the cardiologist as often, giving her more time for her hobbies. Ella exercises more, has more contact with people, and feels less lonely. Her son Paul is involved in a way that fits in with his busy life in Amsterdam. He's now much better informed on Ella's health. The healthcare professionals helping Ella are digitally connected and together form a tailored support team. Thanks to digital technology, Ella is now in control of her own healthcare. She decides how her own life is with healthcare in it. But of course, both community nurse Jeroen and her son Paul still come by in person if it's necessary. Then they have the time they need to assist her. The result? Ella is healthier and her healthcare is better, more effective, and cheaper. This is how Sensire sees the future. Sensire and its partners are already doing their best to make this future a reality.